Hi, you guys. I'm Susie Spell, nurse practitioner with the Mobile Outreach Clinic. We are UF St. John's Care Connect division, and we fall under that. Today, we're going to be talking all about diabetes. November is Diabetes Awareness Month. I can't be with you today, but some of the MOC staff hopefully is there with you and can answer some questions. So let's get started. We are a small but mighty team. Kayla Hurt is our Community Health Improvement Manager of Operations. Michael is our Director of Operations. Alfia is our registered nurse. She's also now a nurse practitioner. And then I'm the nurse practitioner for the bus. And Carl drives the bus everywhere. He gets it in and out of all the tight spaces because that bus is really big. We're going to talk about this rising tide of diabetes in America. It has to do with our standard American diet, the way we live our life, and many other facets that really put us at risk as a population. This is from the American Diabetes Association, which is celebrating its 85th year now. Diabetes is exponentially rising, and it affects over 38 million Americans, and it does have very devastating consequences. And some of those we're going to talk about or at least touch on today. There's almost 100 million adults that are living with prediabetes. There are probably many, many more that are living with insulin resistance, which actually occurs before you even get to prediabetes, which we don't typically check for. But we kind of wait until you become pre-diabetic, and we don't necessarily have to do that. We can turn the car around almost anywhere. But we do have some staggering costs. The next few slides actually came from a handout from the American Diabetes Association. It's almost 1 in 10 Americans that has diabetes. That's children and adults. Many people don't even know that they have insulin resistance or prediabetes. Many people are unaware. And every 26 seconds, so at least 2 times an hour, somebody's being diagnosed with diabetes in our country. And there are a lot of human costs and consequences. So people who have diabetes are really at risk for a number of things. A lot of people with diabetes end up dying of something cardiovascular, which is your heart related. Things like stroke and blindness and kidney disease and people having to be on dialysis, and then nerve damage that can really lead to people getting amputations. And then Americans that have brown skin are actually at more risk for a number of reasons. There's many economic costs as well. So we're talking money. That's why I see the money in the background. The total cost of diagnosed diabetes, this doesn't even include undiagnosed, and prediabetes is almost $413 billion. It is going to be in the trillions before too long. Spending on insulin tripled in the 10 years between 2012 and 2022. That's crazy. I didn't even realize that. And then people who have diabetes, your individual healthcare costs are going to be more than 2.5 times greater than somebody who doesn't have diabetes. I sadly see a number of people who will either delay getting their medication, try to stretch it out, or just make it last a little bit longer because they don't have the money to get it filled. The good thing is there are plenty of other things that we can do that can help. Let's just touch on what diabetes is in the first place. And I'm going to keep it simple to start with, okay? So just the basics is that when you think diabetes, we think high blood sugar. The word we use sometimes is glucose. Glucose means the same thing as sugar, high blood sugar. But as you're going to hear, I'm going to play a video, a couple videos actually, but the one at the end really goes into that the high blood glucose, it's a symptom of something else. When you have low blood sugar, we call that hypoglycemia. When you have high blood sugar, we call it hyperglycemia, so up and down. And many people who have dysglycemia, which is we're not quite pre-diabetic or diabetic, but you're on the blood sugar roller coaster. You go high, then you drop low, then you go high, then you drop low. That's pretty common, actually. We're going to touch on the pancreas and a little bit about anatomy and function so you understand a little bit more of what's going on when it comes to diabetes. Certain cells in the pancreas make the hormone called insulin. Insulin is absolutely critical for life. Before we even had insulin, people that had type 1 diabetes and did not have any of their own insulin would often die young because Even if they eat a little bit of glucose, that could be very detrimental to them. I want to show you a picture. It's a little bit grainy, but the pancreas is sort of shaded. Maybe you can see the cursor here. It's like a little bit elongated, tucked in behind the stomach, sort of like that high stomach area on your body. But when you zoom in on the pancreas, there are a number of different kinds of cells. And actually, the pancreas itself has a couple of different functions: exocrine function and endocrine. Endocrine means hormones, so that is related to insulin. The other parts of the pancreas produce different enzymes that break down our food, but that part I'm not talking about today. The part that applies to diabetes are these little areas called the islets of Langerhans. They're like little islands in there, and they contain beta cells, and the beta cells are what produces the insulin. I'm going to show you a little video. It's just under 2 minutes, I think, about how glucose gets into the cells. We want glucose in the cell to power it up. We don't want glucose staying in your blood and making everything sticky. Okay, so here we go.
When food is ingested, it travels along the digestive tract, where it is broken down into its component nutrients in order to be absorbed into the bloodstream. One such nutrient is glucose, a simple sugar. Glucose gets absorbed by the intestines and then enters the bloodstream. It travels through the circulation to all body cells. Once absorbed into the bloodstream, glucose circulates, causing the blood sugar level to rise. An increased level of blood sugar sends a signal to the pancreatic beta cells, which respond by secreting the hormone insulin into the circulation. Insulin is necessary for glucose to reach and be used by several important target tissues throughout the body. These include the liver, muscle, and adipose tissue. Insulin is necessary to keep blood glucose levels stable in the body. Glucose enters the cell through a process called facilitated diffusion.
Okay, I thought that was pretty good. So who gets diabetes and why do they get it? Anybody can get it. You might have a genetic tendency or predisposition for that, but pretty much anybody can get it. You can be obese, you can be overweight, you could be thin. It can run in your family, or it doesn't have to. So there are many, many reasons and all kinds of people that can get diabetes. Here's a little quiz for you. How many kinds of diabetes do you guys think exist? I want you to raise your hand if you think it's one. Who thinks one? Okay, does anybody think there are two kinds? Okay, good. Does anybody think there are three kinds? I'm hoping you guys are raising your hands because I can't see you. Four kinds? Anybody think four? Any takers for four? What about five? Anybody think there's five kinds? What about six? Do you think there are six kinds of diabetes? Anybody? Anyone going for six? Okay, well, that was a trick question a little bit. There are four kinds of diabetes and two kinds that I call unofficial. And maybe one day they'd be official, but we'll see. Type 1 diabetes used to be called juvenile. We don't call it that anymore. Type 2 diabetes used to be called adult onset. We don't call it that anymore because kids are getting it. There is something called type 1.5, which is also called LADA, L-A-D-A, which is an acronym I'll explain in a minute. Gestational, which is what some pregnant women get. Double diabetes and type 3 diabetes are the two unofficial kinds, those two on the last two that I said, and we'll touch on them as well. Type 1 versus type 2. With type 1, I already alluded to it a little bit when we were talking about the pancreas. We think even when kids get it, that is probably an autoimmune response, and those little islands of beta cells that make the insulin, they get wiped out. And if you can't make any of your own inside your body, you have to get it from the shots. You need insulin to live, and you would need to take shots to do that. That's type 1. Some people are slender, some are overweight. There's no set body type for that. Type 2 diabetes, we tend to associate more with being overweight, but you could also be slender in that one as well. It's where you have insulin resistance at the cell level, which makes the glucose stay in the blood and cause high blood sugar and not get into the cell. You need glucose in your cells so that you can make energy. You need to be able to make energy for all the things that go on in your body. And if you don't change your lifestyle, you will continue down that type 2 diabetes path. I think it's a smidge unfortunate that type 1 and type 2 are called the same thing, but they're actually pretty different under the hood. Gestational is where you have diabetes during pregnancy when you did not have it before pregnancy. It does increase your risk of having a bigger baby. Insulin it's a growth hormone, so it makes things grow. And you'll have an increased risk of having the type 2 diabetes later on in life. Then there's this one called LADA, L-A-D-A, the latent, which means either asleep or unknown. Autoimmune means you're attacking yourself. And then diabetes of adulthood. Often these folks are diagnosed incorrectly to begin with type 2 diabetes. And we don't necessarily look for this in everybody. But if you are diabetic and we are trying multiple medications and you are just not responding to any, meaning your blood sugar is not coming down, your hemoglobin A1C is not coming down, that's the time to say, you know what, let me look to see if there's something autoimmune going on with the pancreas. So that's when we might look for it. An example would be, I had a patient one time who was, I don't know, like 43-ish, got a really bad virus, was really sick for like a week or so, and very shortly thereafter, developed diabetes, was having a hard time managing it, ultimately was diagnosed with LADA. If you're in the audience and that sounds like you, please ask your doctor to check that if they have not yet, or your medical provider. Then the unofficial kinds of diabetes are type 3, which people in my world are calling dementia, which is an umbrella term. Alzheimer's is a type of dementia, are calling that type 3 diabetes because the impact is so huge of insulin resistance on your neurons. We didn't used to think that was a thing. Now we know it is. This is a huge problem for our brains. Then something called double diabetes. Somebody who might have had type 1 diabetes diagnosed when they were young. And then if you're maybe not living the best lifestyle, you can actually develop almost like a type 2 picture where the cells of your body are resistant to the insulin that you are injecting. It's a double whammy that we don't want. Let's talk about risk factors for a minute. There are modifiable risk factors and non-modifiable. Non-modifiable risk factors are things like your family history. You can't pick your parents. Genetically, you might be predisposed to any condition, including diabetes. Your race, your ethnicity, you can't change. Your age. The good news is there is so many things that you can modify that are so powerful, more powerful than you think they are. Number one, the most impactful, I would say, is a highly processed diet or a lack of having a lot of fruits, vegetables, nuts, seeds, grains, all that kind of stuff in your diet. If you tend to be somebody who puts on weight in their belly, like having a lot of belly fat, that tends to be what we call visceral fat, so fat around the organs, and that can be a risk factor. Chronic stress, not sleeping enough. And the other thing about not getting restorative sleep, you need to have enough time to sleep, number one. Number two, if you snore and you have not had a sleep study, please talk to your doctor or your medical provider about that. Sleep apnea is missed a lot. People don't even want to go because they don't want to have to wear the CPAP. There are so many reasons why you need to have adequate sleep at night. And This is one of them. Another thing that's not on here, but if you are a shift worker, anybody that works night shift actually is at higher risk for developing diabetes as well. And then hormone imbalance. So that might be something like polycystic ovarian syndrome, or it might be perimenopause, menopause, kind of hormonal fluctuations that can predispose you as well. And then some symptoms. One of the things about having high or low blood sugar, or high especially, you might not feel a whole lot. But if you're the type of person who gets hangry, have you ever seen that Snickers commercial where the person's really hangry, they eat the Snickers and they're fine again? So when you get hangry and irritable and you're jittery and shaky and you need to eat something so that those symptoms go away, that was hypoglycemia. You had low blood sugar, you ate something and it came back up, so now you're feeling better. The sign that you don't have any dysglycemia means up, down, all around, okay? Meaning that you are good to go with your blood sugar. If you just get hungry, you eat some food, and you're not hungry anymore, and you don't have any other symptoms at all, your sugar's probably good. If you tend to have any of these symptoms, on the left is the low blood sugar things, sweating, hunger, feeling kind of sleepy, lacking some coordination, jittery also, feeling hangry and irritable. And then on the right side is hyperglycemia. And I would say that people maybe don't feel this one quite as much as the low blood sugar. It doesn't seem as dramatic, but if it's gone on for too long, if you have an increased appetite, increased thirst, you're peeing more, those are red flags for me that you might have blood sugar that is way too high. You can even have blurred vision, and part of that is because this is damaging the back of your eyes. Let's just look for a minute at diagnosis. This is a great chart. It came from a course that I took about reversing diabetes. And I'm talking about type 2, not type 1. Type 1 cannot be reversed. But for type 2, they did a study, I believe it was in Guam, and it was with the E4 Diabetes Solutions, which is on the very bottom of the chart if you see it. If you look on the, it says fasting BS, and BS means blood sugar. Okay, BS is blood sugar. If you look at the fasting line and you go from left to right, there's the optimal, which is like 70 to 85-ish. And then as you go along to the right, that's where you have critical diabetes down at the end and increased risk of heart disease and all kinds of things. Now, a lot of times you could pull out all of your records from all those metabolic panels you've had over the years, and you could actually watch your fasting blood sugar tick up and up and up. And you might have even been told by a medical provider, oh, we'll just watch it. Caution that statement of we'll just watch it. We'll just watch it till you cross 100 and now you're pre-diabetic. We'll just watch it until you cross 126 and now you're type 2 diabetic, and then we'll do something. We can turn the car around way before that. So if you're already in that direction, there's a lot we can do to make it better. There's something else that we measure called hemoglobin A1C. Hemoglobin is a structure in your red blood cells that hangs on to oxygen, but sometimes it gets sugar stuck to it. And when it does, it's called glycated hemoglobin. It's where glucose gets attached, and that is what your hemoglobin A1C is. And we're looking at what percent of your red blood cells have that. I use different analogies because this helps me remember and it helps patients remember as well. Think of it like everything is sticky. One analogy I use is, let's say you spilled some soda on the floor and you didn't wipe it up and it dried up. As the days go by, it's going to get pieces of hair and dirt and stuff stuck to it. It's sticky. That's what happens inside your blood vessels if we can't get that glucose inside the cells. It's also caramelizing. Think of it like that. It's like your blood is caramelizing. We don't want your red blood cells caramelizing. They need to be not caramelized. Like you can see the example of the apples right here. This is a chart that tells you based on what your A1C is, what your average blood sugar runs. So 4 or 5, I think, are the best. Your average blood sugar might be around 80. That would be great, a 5. If you're 5.2, 5.3, okay, fine, that's all right. But once you cross 5.7, now you're in the pre-diabetic stage. If you cross 6.4, you're now type 2 diabetic. And so you can see that that would correspond to somewhere in the 130-ish range. And then having this really presents a lot of opportunity for complications. Same thing with blood pressure. I feel like it's a very similar conversation. When you have high blood sugar, this stuff is going on and you don't feel it, but you are at risk for things like a stroke and a heart attack, having what we call peripheral arterial disease, meaning you don't have great circulation to your legs. And if you don't have great circulation to your legs, then you are not going to have circulation to the little tiny nerves where the teeny, 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 tiny vessels have to get to those nerves to feed it oxygen and nutrients. And if you can't get those there because it's too sticky, then you are set up for having a sore on your foot that won't heal or an amputation. So that's why we tell you, if you do have diabetes, you really should be checking your feet every day. You can also have trouble with your vision and develop eye problems. I would hate for you to lose your vision just because you have diabetes. And then treatment. Let's just touch on that for a minute. I can't possibly go through all the treatment algorithms that we use as medical providers, but just under the medication umbrella, there are pills and there are shots. And the pills come in different categories of how they work in your body. Some people end up on 2 or 3 of them. Sometimes we get to insulin. I try to delay starting insulin for as long as we can. But nowadays, there's also the shots that you've heard a lot about, the weight loss shots. And they were originally for diabetics because they help to bring down your weight and control your sugar. Those can be very helpful. Also, very powerful, which I did not know until I went and learned about lifestyle medicine a few years ago, is just how powerful your life is, actually. Diet is going to be the biggest return on investment, meaning if your diet is poor now and you improve it, you are going to improve your blood sugar. And I would say any movement towards a whole, real food diet that has a lot of variety of plants in it, you're going to be a lot healthier than if you're not doing that. I would like everybody to try to eat 30 to 40 different plant foods in a week. Even if you're still eating meat, it's fine. But if you pull in a lot of really good fruits and vegetables, that would be ideal. Now, you might need to decrease your grains a little bit just to get it down to a couple servings a day. For fruit and vegetables, there are some that are higher glycemic index. The tropical fruits like pineapple or mango and things like grapes, those are going to bump your blood sugar more dramatically than something like blueberries and raspberries and blackberries will. So choosing in the fruit and vegetable category, things that have a lower glycemic index. You can look that stuff up online and find lots and lots of really great lists. A great tactic is to move after you have eaten. Let's say you have a meal and about 10 minutes later, you just go for a little walk. I don't know, 5, 8, 10 minutes. It doesn't even have to be particularly brisk. You just have to get out there and move. Would be nice if it was brisk though, I will say. You can bypass that insulin mechanism and the glucose can go in the back door of the cell and get in there without the insulin mechanism. I wore a continuous glucose monitor myself just to see what would happen over 2 weeks. And it was really interesting. If I would see my sugar go up after a meal, I would just go take the dogs for a quick walk. And by the end, it's back down to normal. It's pretty amazing. And then getting enough sleep, 7 to 9 hours a night. If you snore, please get that checked out. A number of reasons why you need correct sleep architecture, which also includes cleaning out all the debris from your brain every day. So you need it to do that. You need to feel rested, to feel sharp mentally, and also to reduce your risk of diabetes and cardiovascular issues too. All the things to avoid will be things like tobacco, smoking, vaping, drugs, alcohol. I mean, if you want to have a glass of wine every now and then, fine, but I would say don't make it a nightly habit. Calm, find ways to ease stress. We all have a lot of stress in our lives. Stressing less is going to be very, very important. And one of the ways you could do that would be connecting. Connection is hugely important to our human wellness. And by connection, I mean connecting with yourself, maybe spending some time alone, or meditating or praying, time with your family, the ones you like, and then friends, your community, with our natural world. Having that connection over time is actually very, very therapeutic. Okay, so I have a video here that was done by my colleague, Dr. Beth Motley, and she practices in South Carolina. She made this video, which when I first saw it and started learning about the physiology of all this a little bit more, I was like, wow, this is a great video. It is about reversing diabetes with a plant-based diet. I'm not asking you to be plant-based. If you wanted to be plant-based, I think that'd be great. If you wanted to eat lots and lots of plants and still eat your meat, do that. But I just love this video because it gives us some really great insights. At the end, she shows us some meal ideas that are plant-based. But if you're like, I'm not going to do plant-based, okay, fine. So let's do a little lean meat. Imagine a little shredded chicken on top of like the tacos that she shows. Just use your imagination. Let me get it started.
What causes insulin resistance, or what causes diabetes in terms of what we eat? Most people associate sugar and diabetes, and so the thinking is that sugar causes diabetes. You have a big plate of 100% whole wheat spaghetti. Let's look at what happens when this enters our body. So starch, that's our long chains of carbohydrate. That breaks down into glucose, the small little bits of carbohydrate. Glucose goes all throughout our circulation and is stored in our muscle cells. That way, when we go to do a bicep curl, that energy is available where it is needed in the muscle cell. So let's zoom in and look at that muscle cell and look at exactly how we store the glucose, the sugar, in the muscle cell. So this is a picture of a muscle cell. Up top, we have our insulin receptor. Down at the bottom, we have our glucose vesicle that's waiting to pick up the glucose that's hanging out outside the cell in the bloodstream. Insulin is our key. It unlocks the door. It signals the insulin receptor, which signals all of these downstream enzymes that together allow the glucose vesicle to move to the edge and invite glucose into the cell. That is how a happy cell should work. But what if there was no insulin? Quite simply, if we don't have the key to unlock the door, of course, sugar is going to build up outside the cell. That's what happens in type 1 diabetes, which is not the case in most people. But what if there is enough insulin, but for some reason the insulin doesn't work? So in this scenario, we have the key to unlock the door. It looks like all the players are in place, but something is gumming up the lock in our muscle cell. What's gumming up the lock in our muscle cells? It's intramyocellular lipids, or fat, in our muscle cells. So in response to a high-fat diet, those fatty acids in the bloodstream, they enter the muscle cell, they break down into free fatty acids and all of these toxic breakdown products that together block the insulin signaling pathway. So there are two approaches to treating diabetes. In the first approach, we take a look at this scenario and we say, you know what? You have insulin resistance. Your muscle cells are shot. The next best thing to do is go on a low-carb diet, because how can your sugar possibly spike if you are not consuming any sugar? So what happens is people will start to follow a more low-carbohydrate eating style, and they're eating more meat, more cheese, and maybe a side of broccoli also. They're eating a diet that is higher in fat overall. The problem with this approach is it's not actually addressing the insulin resistance. The second approach to treating diabetes, as recommended by the American College of Lifestyle Medicine, is a more plant-based eating style. That means we're focusing on fruits, vegetables, whole grains, beans, and as you can imagine, these foods tend to be very, very low in fat. By following a more plant-based diet, we can unclog the muscle cell and repair the underlying mechanism. So the difference is a low-carb eating style can control the symptoms of diabetes, but we're not actually addressing the underlying insulin resistance the way we are with a more plant-based eating style. So what exactly is a plant-based diet? So the full term is a whole foods plant-based diet. Whole foods meaning single ingredient foods, unprocessed or minimally processed as they exist in nature. Plant-based, in its broadest sense, means we're consuming at least 95% of our calories from fruits, vegetables, whole grains, and beans. Typically, when we're working on reversing diabetes in the office, we recommend going 100% until we start to see the results we're looking for. For a lot of people, complete abstinence is easier than perfect moderation when it comes to a plant-based diet. So what's the deal with carbohydrates, right? When we talk about plant-based diets, people are told, okay, we're going to cut out more of the meat and the cheese and the high-fat foods, focus more on plants. People are still pretty hesitant with carbohydrates. So let's look at carbohydrates. They are not all good or bad. It depends on the type. So on one end, we have our unprocessed or minimally processed carbohydrates. These are our sweet potatoes, the logs on the fire. They are loaded with fiber and water and allow a nice slow release of energy. On the other end of the spectrum, we have our highly processed carbohydrates. This is our frosted flakes. These carbohydrates are digested quickly. They're void of fiber. A lot of times the water's removed. We've lost a lot of the nutrition and we get a big spike in energy. What does process really mean? It is any means by which a food is broken down or prepared. So typically we add salt, sugar, fat, making the food more addictive, more caloric, more delicious. At the same time, we are reducing fiber and water, making the food less filling and thus easier to overeat. Plain old corn is an unprocessed food. It is a whole plant-based food. Highly processed, that's our frosted flakes, potato chips. Those are the foods we want to avoid. Same idea with potatoes. People are racist against white potatoes because they are white, but they have nothing in common with highly refined white foods like Wonder Bread. So a potato is actually a great choice. It's going to be very, very low in fat to help you unclog those muscle cells, and the calories are fairly dilute due to its fiber and water content. But the reason potatoes are a problem is what people put on them or what they make the potato into, like the potato chips. Same idea with wheat. Shredded wheat cereal, unfrosted, of course, is going to be our least processed option. As we process, we get things like great grain cereal or crackers, cookies, etc. that are not going to be great options. Same idea with rice. Brown is best. With oatmeal, our best options are steel-cut oats or something like old-fashioned oats. These are going to be minimally processed. We want to avoid instant oats and refined oatmeal snacks. So what should I eat? No, this is not a lettuce and tomato diet. This is not a rabbit food diet. A lot of people think a plant-based diet means a vegetable-based diet, and then they're set up for failure if all they're going to eat is vegetables, right? You cannot sustain yourself on lettuce, tomatoes, and vegetables alone. So this is what it looks like. Lentil tacos, mixed bean chili, grain bowls, loaded sweet potatoes, African peanut stew, black bean tortilla soup, vegetable fajitas, spinach and mushroom grits, vegetable tamales, rice and beans, collards, black-eyed peas, sweet potato black bean quesadillas, stuffed peppers. A lot of people overestimate how hard it will be to switch to a plant-based diet, but once you get going, it is quite easy to continue. If you want more information on reversing your diabetes with a plant-based diet, I'd recommend Neil Barnard's book, Program for Reversing Diabetes, which can be purchased on Amazon. Also, if you want to follow me on Facebook, Food is Medicine Greenville, I post resources quite often on specifically reversing diabetes.
Okay, so I thought the video with Beth Motley was really good. It does explain some of the underlying mechanism. There's another researcher out there named Ben Bigman who actually studies insulin and metabolism. And his opinion is lipotoxicity is maybe not the primary driver, although it plays a role. It may be if you're eating too many processed foods, your body just gets bombarded with those. Your pancreas is pushing out a bunch of insulin and it just gets tired of that. You need to reduce that burden in order to undo that. And I believe that's probably true as well. There are a couple of other books that I want to show you that can be very helpful on your journey. There is one by a researcher from the UK who has been studying diabetes for 40 years. He has discovered that what happens is you get insulin resistance at your muscle level first. And then what happens is you begin to get insulin resistance at the level of your liver and at your pancreas. You start to put some fat into those organs. When you offload that fat, and you can do it in many ways. One way that he does it is to drastically reduce calories every day. And you can do it that way. You reduce that burden, and then you can become insulin sensitive again. The thing about fasting sugar in the morning, your liver is always putting out a little bit of glucose. Your brain runs on glucose. So it's trickling out a little bit, and it is modulated by the pancreatic insulin that comes out is like the dimmer switch for how much of that glucose should come out of the liver. When your liver is not listening to the insulin, it's more like gushing out. So in the morning, your sugar is high. Some people will say, I don't know why my sugar is so high in the morning, but that's why, because you are insulin resistant at the level of the liver. I hope that makes some sense. But this guy, Rob Taylor, who is a physician researcher in the UK, has done a lot of work on this. So Life Without Diabetes, it's a great book. It's kind of sciencey though. And then another one, which is great. Some people read it and they're like, too strict for me. I'm not doing that. But it's really understanding about what the video showed you, Mastering Diabetes. This is a pretty good one too. The one Dr. Motley showed, Reversing Diabetes with Neil Bernard, that's a great one too. There are others out there. Every time I do a lot of research on different dietary patterns, I always end up coming back to lots of plants. If you want meat in there, high quality, begin to really understand where your meat is coming from. Is it grass-fed, grass-finished beef, right? That is their natural diet? Or is it beef grown in a contained feeding lot where they're not eating their natural diet? That totally changes their meat that we're eating. So when I start working with people, we do one thing at a time. You don't have to do everything all at one time. I hope this was helpful for you or for somebody that you know. Everybody have a great rest of the week. Bye-bye.